Hello and welcome to this week's Facebook Live as we continue to explore Floyd's response to COVID-19. I'm Dan Bevels from Floyd's Public Relations Department, and we're glad to be with you again this week in this effort to share as much information as we can and answer some of those questions that we get regularly via social media. And we're glad to do that over the next 20 minutes or so. Joining me again this week is Floyd's President and Chief Executive Officer, Kurt Stuenkel. And Kurt, thank you as always for taking the time to talk to us.
Happy to be here.
Kurt, we want to talk a little bit about, or in response to some of the questions we're getting on social media. Certainly people have seen some of the work being done in the parking lot, and we're going to get to that, what that means for the community. But before we do that, can you just give us an update in general, where we are at Floyd, how we continue to respond, and I guess the latest information for our folks?
Okay, happy to do that. As is the whole rest of the nation and the world, we're responding to the events as they present themselves to us. And we are taking care of patients that come to our emergency room and come to our urgent care centers, as a matter of fact. More patients come to our urgent care centers presenting with a fever or a cough or congestion. And they're wondering, gee, is this going to be COVID-19 that I have? And those that do present themselves with those symptoms, we do a test. Many of these folks can go home and while they await their results. A small percentage of those who present, may need to be hospitalized, but it's really the minority of patients that need hospital care. Most folks, they can go home while they're awaiting their test results. And so we've been monitoring those numbers and taking care of patients. We, on average, are seeing about 8 to 10, maybe 11 patients who are actually positive for COVID-19 that we're taking care of here at Floyd on a daily basis. And there's usually about 15 to 20 that we call PUIs, and that just stands for persons under investigation. That's the terminology that's evolved. It just means we're waiting for a test result. And so we take care of them as if they have it until we get that test result. But then most of the time, those end up negative, and then we take care of whatever the reason is they needed to be hospitalized, and they go home. And similarly, that happens with many of the positive patients. You don't necessarily get hospitalized just because you're positive. You get hospitalized because you can't catch your breath, you need oxygen therapy, or you may even need to have mechanical ventilation. And every day, it seems, we send people home that are positive for coronavirus 19, and then they finish their recovery at home. And so we just continue every day to take care of these patients, and we're monitoring our numbers, and our numbers are higher than when we started early in March, but they seem to have leveled off a little bit. We are taking some hope in that. We hope that all of these social distancing practices that everybody has emphasized, like staying 6 feet apart from one another and being careful and practicing hand washing multiple times a day, we're hopeful that all of those things are indeed having an effect. And our rapid ascent that we thought we might have in numbers has not been there.
Yeah, we are definitely following the 6 feet apart as we try to do each week.
Right.
It's always, we feel like we're putting together a puzzle how we shoot this and still remain distant. So no question, we're taking it very seriously in everything we do. I'm encouraged, so many folks want to focus, rightfully so, on the number of positive cases that are happening all over the world. But we are encouraged to see that folks right here in Northwest Georgia recovering from this and getting, to the degree that they can on with their lives.
Well, that's right. I mean, the vast majority of people that get exposed, if they turn positive, they're not going to be hospitalized. I think the percentages are about 80% of the folks that get it recover at home. Some of them need to be hospitalized, and the vast majority do get better. Now, there is a percentage of folks that are dying from COVID-19. I mean, we got to recognize that and understand it. It's very serious, and we've got to take care of and pay attention to that.
Absolutely. Well, let's talk a little bit about some of the prep work we're doing. We've had questions both from local media and also just folks driving by on a daily basis. Hey, what's going on in the parking lot? And we've addressed some of that already, but I wanted to talk a little bit about the positive side of that, and just the idea that there's nothing scary. There's nothing that it's not because we know something. It's because we want to be prepared should it be needed. Could you talk a little bit about why we're doing that and what it really means?
Yeah, I'd be happy to. In fact, just yesterday I talked to a representative at the governor's office, Governor Kemp's office, and asked him what their projections look like for our area. And I talked specifically about what we're doing out in the parking lot, and I asked him his opinion on that. But let me first talk about why we did it. I mean, why we are putting facilities out in the parking lot. And just think back 2 weeks ago. 2 weeks ago, seems like an eternity, but just 2 weeks ago, from the federal government, from Dr. Anthony Fauci, he stood at the podium with President Trump and said, we expect between 100 and 220,000 deaths from COVID-19. We've got to practice social distancing. We've got to shut down non-essential businesses, and state by state, people responded to that. And then it wasn't a week later, in fact, it was a following Monday, they announced, okay, we've re-looked at our projections and now it's 60,000. And that's still the number, but it may even be lower if we continue to practice all of the things that we're supposed to. So if you go back to 2 or 3 weeks ago, we were looking at those numbers as they would translate to Northwest Georgia. And so thinking that, gee, we may be facing something overwhelming, we started our plans to take care of more patients. And so that's why when the Georgia Emergency Management Association, sometimes called GEMA, offered us, well, we'll put a 20-bed unit at your hospital. Do you want it? We said, yeah, we want it. And so if you drive by and you see some round concrete pillars sitting in our front parking lot, that's the foundation for that modular 20-bed unit. But then our worst case scenario showed us needing some more beds, so we planned some more beds in our lower level of our parking deck. And if you think about what's happened in New York City and Detroit, Chicago, I mean, they've taken the Javits Center in New York City to create a big ward there, did the same thing in McCormick Place in Chicago. So on a much smaller scale, that's what we were preparing for here. As I talked to the representative from Governor Kemp's office yesterday, I said, what are you seeing for projections in our area? And he said, well, quite honestly, we haven't really focused a whole lot on projections for your area. We've been worrying about Southwest Georgia, where they're a lot further down the road and a lot more disease and a lot more deaths, quite frankly, in Southwest Georgia. And I said, well, what do you think about our 100-bed unit and our 20-bed unit out front? I said, are we really going to need that? He said, well, we're doing a 200-bed unit at the Georgia World Congress Center. That was reported, by the press in Atlanta. And I told the governor, and this is him talking, he said, I told the governor, it's better to build it and not need it than to need it and not have it. And so that's my advice to you, Kurt. He said, I think you should go ahead and finish building it. And if you don't need it, then hallelujah. And so that really is our approach. And right now, as I said earlier, our numbers are lower than we thought they would be, and maybe we don't need it, but we're going to finish it. That's what the state of Georgia is doing in Atlanta, so we're going to follow through and have it ready. And if we need it, people can be comforted that we can take care of you. But let's hope we don't need it.
And we talk about this on a weekly basis. It's just part of what we do every day here at Floyd, which is do everything we can to prepare for providing the best care we can for folks.
Well, that's right. And so we'll be ready. If it's needed, we'll be ready. And I want to say here, in addition to this, is people see it and they think, gee, man, are things going on here that we don't know about? Is there COVID-19 running rampant through Floyd Medical Center? And the answer to that is we do have patients here that have COVID-19, but this is a safe environment. We practice all of the proper precautions. Our staff are using PPE, and it's really a safer place to be than the grocery store. Because you walk through the halls of Floyd Medical Center, people are taking the proper precautions, and the patients that we're taking care of in isolation and negative pressure rooms. That air is not recirculating throughout our facility. It's a very safe place to be. Now, people may also say, well, what about that visitor restriction? Is that so they wouldn't be exposed? Actually, it's because we don't want the public coming exposing everybody else. So when you wear a mask in public, you're actually protecting other folks from your droplets as you cough, as you sneeze. It's more protection for other people than it is for you when you wear a mask.
I'm really glad that you touched on the safety aspect and all that we do to keep our visitors and our patients safe, because one of the questions that's come up is it safe to come to your ER for something other than to be tested for COVID-19? And the reality is absolutely. We do everything we can to keep that as a safe place. So we want to encourage folks to not sit home and wait. Come on in and let us take care of you.
Well, I'm glad you raised that issue about the emergency room and seeking care. I've had some conversations this week with a couple of physicians who were really concerned. One of them shared an article with me where on a national scale they were talking about emergency room volumes being down and people showing up with heart attacks being 50% less. Well, did cardiovascular disease just suddenly disappear? No, it didn't disappear. People with signs and symptoms are staying home. And if you stay home and delay care when you need care, you can get worse. There was one surgeon that said that a patient stayed home when they had a pneumothorax, and he said, if that patient had come to the ED when they were in distress, we could have dealt with that within 36 hours, and now that patient is in the ICU. And so folks don't need to delay care. If they're feeling signs and symptoms, we can take care of you. It's a safe environment. It's better for your long-term health. Seek care. If you have a doctor's appointment, go see your doctor. If you're feeling bad, if you're feeling the signs of chest pain or stroke or numbness, come to the ED. I mean, it's going to be better for you, and we can take care of you. It's a safe environment.
And that's a policy that is just as true for our urgent care locations. If you need to see a physician at one of our urgent cares, we encourage you to come in because, again, we're doing everything we can to separate those patients who might have respiratory issues from everyone else.
So that's correct.
Yep. Kurt, before we wrap up, the other very exciting thing that happened at Floyd this week is we were able to participate in a program that a lot of folks are asking about, and that's this convalescent plasma program, which takes plasma that's donated by recovered patients, and then we're able to attempt to use it as treatment for patients who are currently suffering from COVID-19. And we're going to provide some information for folks who are curious about how to get involved in that. But before we do that, it's just, again, one more aspect of what we do to be kind of on the cutting edge of technology and treatment and everything else.
It's a wonderful story. One of our radiologists, a member of the Rome Radiology Group, Dr. Matt McLean, has taken a real interest in coronavirus and particularly COVID-19. And in fact, he was the one when our index patient, what we call our index patient, our first patient, which was early in March, when this patient showed up with signs and symptoms, and all we had available to us was the travel questionnaire. That's what public health told us to do. Well, ask if they'd been to any of these hotspot countries. And if the answer's no, well, they're good to go. And so we had a patient that presented and passed the travel questionnaire and showed up again another couple days later. And then we did a chest x-ray and a chest CT, and Dr. McLean and some of his colleagues read that x-ray, those x-rays, and said, this looks like what we're reading about. We think this might be COVID-19. And they were early and they were right. I mean, they had been keeping up with the literature just through his own intellectual curiosity as a physician, being on the cutting edge. Well, he continued with that in his investigation and staying current with things, and said, plasma therapy, which is, when they draw a unit of blood and spin it down, take the red blood cells and platelets out, the plasma is the whitest liquid you have left over. Plasma therapy has been used for the treatment of diseases for eons, and he had researched and found that in an experimental basis, it's been used in multiple places. He signed up for the Mayo study and established a not-for-profit organization came to us, presented it to one of our committees. It's called the Institutional Review Board Committee, that looks at things that are somewhat experimental and investigatory. We approved it, and we've now infused 6 patients. So he did the research, he set up the not-for-profit company, he coordinated with blood assurance for the collection. We contacted patients that had recovered from COVID-19, and now we've infused 6 patients. So it's early, but we've had some early encouraging results from these patients. So you're right, I mean, it's a really exciting and wonderful thing. Right here in Rome, Georgia, we're participating in a national study, and I haven't heard of anybody else in Georgia that's done this.
Right.
We may be the first. I hope others do it, and I hope we're very hopeful that it's going to be very effective.
And I think just to wrap up, we just want to just say to you that we're doing everything we can to take care of folks and to offer the same excellent care that we did before COVID-19. We're doing the same thing now, and that's just one of the innovative ways we're doing it.
Well, that's right. And again, I want to encourage folks, if you're feeling ill, then you would normally want to go to urgent care, your doctor, the emergency room, do that. Your health is at risk.
As we wrap up, if you're interested in learning more about this convalescent plasma program, we encourage you to check out a couple of websites. One is plasmatx.org. That's the website that Dr. McLean set up. It's his nonprofit, and it's a great resource. It gives you information about how the program works and how you can get involved. They are screening and talking to patients who have recovered on a daily basis. As I understand it, they're just being inundated with requests for information and folks calling in and saying, how can I help? So that's plasmatx.org. And then, of course, our friends at bloodassurance.org as well. Those folks at Blood Assurance are doing a fantastic job. And just to give a plug for them, you know, they're out so often at factories and businesses and offering folks an opportunity to donate blood. And many of those have been canceled because of this situation we're in now. So we encourage you to reach out to Blood Assurance and ask them how you might be able to donate, because that need for blood is just as great, if not greater now, as it has been. So plasmatx.org and bloodassurance.org are 2 great sites for information about these 2 programs, and we're excited to partner with those folks. Yep. Well, Kurt, thank you as always for joining us. It's again, just I can't tell you how much I appreciate just your willingness to share with us as employees, but also with the public. We really appreciate it.
Thank you, Dan.
All right. Thank you so much for joining us. I want to encourage you to go to floyd.org/COVID-19. That's the site for all the information related to our response to COVID-19. You can find FAQ there, as well as up-to-date information from the CDC and other resources that we use throughout this pandemic as well. So that's floyd.org/COVID-19. Thanks so much for joining us. We'll be back next Wednesday at 3 o'clock with another edition of this Facebook Live that's in response to this pandemic. Next week, we're going to talk a little bit about our telehealth program and how that's operating and how you can get involved in that through our primary care network. So that's coming up next Wednesday at 3 o'clock. Until then, I'm Dan Bevels for Floyd Medical Center. We thank you for joining us and encourage you to be safe. Thanks.